If you've ever been to a hospital or clinic and wonder how medication is added to IV bags such as this, well, you're in luck because I work in a pharmacy department at a hospital and we add medications to IV bags all the time. It's not really hard to do, but there is a right way and a wrong way of doing it. So let's get started. The first thing you want to do is have your IV bag. This is just a 100 ml saline bags. The bags come in all sizes and different types of solutions. It all depends on what the patient needs, but this is the IV bag we'll be using today. Then I also have a normal saline vial. Normally you would have a vial that's got medication already in it that we'll be injecting, but we're just going to be using this as a tester. And then I got a 5 ml syringe that we'll use today, and I got an 18 gauge needle here that we'll use. And then you'll have some sterile wipes to use to wipe clean on the injection site, and then stickers to plug up the hole at the injection site. So yeah, first thing we want to do is clean off the injection sites, which will be injecting the needle here. Make sure you don't touch it so it doesn't get contaminated. Now we got the vial. We're gonna wipe off the top here, make sure that's clean. Now we'll assemble the syringe. It's twists on here, and it'll look like that. Now before we inject the vial, the one thing you want to make sure you not do is core the vial. And coring the vial is when you inject the syringe at the top, a piece of the rubber from the top of the vial falls into the liquid. That can potentially get drawn back up into the syringe and then added into the bag, thus contaminating the bag and also possibly having a floating solid go into the patient. So yeah, it's definitely bad. Don't want to do that. In order to not do that, there's a right way of injecting. I don't know if you can see the needle. The needle, there's like a really thin part, that's the bevel. And when you inject it, you want to press down on that going backwards, thus making like a really small site. And then you inject. And then what we want to do is draw up, let's say that the patient needs 3 mLs of the drug. So we'll draw up to 3. Now I got 3 mLs worth. Make sure there's no big bubbles or anything like that. Now I got our bag, and everything is all wiped and clean, and then you just inject like so, and then you press down on the plunger. That's all good. And then you'll recap. And it twists off, and you just throw it away in the waste bin or a sharps container for that. And now we got our bag, and we'll add a sticker at the end. This will cover up the injection hole like so. And then you hand it off to a nurse, and then they're able to take care of it from there. Now what they would normally do, and I brought this, was a drip set. And this attaches to the end of the IV bag here. You would take this cap off, and then you put this part here at the site, and then the drug would start dripping into this end. This end you attach to a needle, and that attaches into the patient, either here. Well, yeah, it goes into the arm here. So yeah, and that's how the drug is administered after you've added medication to it. So now that you have an understanding of how to administer medication to IV bags, just be sure to not touch any of the sterile parts after you clean it so you can avoid contamination. And then also make sure when you draw up the medication from the vial to not core the vial and having the rubber fall in. All right, thanks.